Good evening. Thank you for joining us. I'm Yoon Jung-min. As the collective action by trainee doctors continues into the 7th week, President Yoon Suk Yeol made a personal address to the Korean public, explaining why there must be an increase in the number of medical students, while reissuing his call for dialogue with the doctors, hinting there may be room for negotiation. Our presidential office correspondent Oh Sooyoung starts us off.
President Yoon Suk Yeol is urging the thousands of trainee doctors on strike to return to their patients, while hinting there's room for talks on their demands if they come up with more appropriate evidence-based proposals. This came on Monday as the president made a live televised address to the Korean public to stress the urgent need for medical reform, namely by expanding the annual quota of students admitted to medical schools by 2,000. The policy has been opposed by some 12,000 junior doctors who've staged a walkout since late February, compromising medical services nationwide and exacerbating staff shortages, particularly in already underserved areas outside Seoul. Yoon said 2,000 additional students is the minimum number of entrants needed to fundamentally strengthen the medical system, with demand for healthcare expected to rise in the rapidly aging country.
지금 당장 5,000명의 의사가 더 필요합니다. 결국 2035년까지 최소한 15,000명의 의사를 확충해야 합니다. 증원에 반대하는 이유가 장래 수입 감소를 걱정하는 것이라면 결코 그렇지 않습니다. 현재 우리나라 의사들의 평균 소득은 OECD 국가들 가운데 1위입니다. 20년 후에 의사가 2만 명이 더 늘어서 수입이 줄어들 것이라는 걱정은 기우에 불과합니다.
He noted that South Korea has a shortage of 80,000 doctors, falling below the OECD average of 3.7 clinicians per 1,000 people. That's despite the proportion of healthcare spending relative to GDP growing 3 times faster than the OECD average over the past 6 years. Thus, he said it would take about a decade for the additional medical students to expand the pool of qualified doctors, and at least 20 years for the number of doctors to increase by 20,000. Conveying his sorrow for the continued standoff between the government and junior doctors, Yoon said there will be legal consequences for the collective action taken by interest groups that threaten the lives and well-being of Korean citizens. He noted that some 8,800 are currently facing medical license cancellations.
제가 대통령으로서 앞으로 수많은 국민의 생명을 구하고 또 수많은 국민의 건강을 지켜낼 여러분을 제재하거나 처벌하고 싶겠습니까? 여러분은 대한민국의 매우 중요한 미래 자산입니다. 국민이 여러분에게 거는 기대와 여러분의 공적 책무를 잊지 말아 주시기 바랍니다. 환자가 기다리고 있는 의료 현장으로 조속히 복귀해 주십시오.
Although doctors' groups have rejected the government's call for dialogue, Yoon seemed to offer some room for negotiation, saying he is willing to discuss more appropriate and reasonable measures. The president said if the medical sector insists on lowering the number of additional entrants into medical schools, it should present scientific evidence and a unified set of measures to the government. Yoon reiterated his commitment to implementing an all-out medical reform to make quality healthcare available throughout the nation, fairly utilise and compensate medical workers, as well as protect them from excessive litigation.
The president this month will launch a special committee under his supervision to promote dialogue between policymakers and the medical community in order to coordinate and initiate a comprehensive reform. Oh Sooyoung, Arirang News.